Welcome, everyone. Welcome to Elian's Joy today. I am super grateful to see you. Thank you for tuning in. If you are here live on Roku or Amazon or Apple TV, then welcome to Elian's Joy. Very glad to see you. And of course, if you're tuning in on podcast as well, glad you're listening. So I have a great show for you today with some information that is near to my heart. And I want to give you a little bit of an overview of what trauma-informed care actually means. And in order to do so, I'm going to share some information with you that I also share when it comes to talks, right? When I do presentations on it, when I share it with people, something that is very important right now with the state of mental health in our country, and not just in our country, I suppose, with the state of mental health overall in the world, right? So a different approach, a trauma-informed care approach in different settings is very important, and I'm gonna share some of these benefits and some of these outcomes with you today. My name is Elian Haan. I am a trauma-informed coach, and I work with people in anxiety, depression, PTSD, trauma especially. I work with executives in a confidential setting where we can talk about work-life balance and the things that are still bothering you, the things that are still coming up, the things that are still maybe holding you back to achieve ultimate success and go through that transformation. And I work with women in their 50s that are stuck and that are, they feel maybe a sense of loss of purpose, not really knowing what they're feeling passionate about, and so forth and so forth. You can find me, elianhaan.net, and you can make a free, of course, schedule a free appointment with you at any time if you want to talk about something that is near to your heart and see if we can work together on that. I am a coach as well as I give, of course, guidance. I give you some tips. Sometimes I am just the best listener of the week, right? So it's not necessarily about giving advice. Sometimes you just need to be listened to. And that is what I love to do. I love to work with my clients. I come from a long decade now of helping people with moving through the past and moving with that past, because I don't want you to let it go necessarily, but I want you to embrace it. Start acknowledging that you needed this past, as bad as it was, to come out on the other side and to be your true self. So go through that transformation so that you can move through, move with, and then move forward and move up. That's what I always say. And I love to help you with that. Now, on a bigger scale, why do I love to talk about trauma-informed care? Not just on the mat, and that would be the yoga mat, as I used to teach this trauma-informed care on the mat information to people that are professionally in the business of teaching yoga, or are teaching meditation, or are teaching a variety of forms of exercise. Why do we need to, period, be more careful with the people that are walking through our door? That means on the yoga mat, you're just not going to go say corpse pose or bend over, and you're going to treat people different because they might have a lot of physical pain, a lot of physical issues, a lot of things that they're holding on to that we are not aware of. And although we can always be aware of the things that are playing in people's mind and what people are scared of and what people are fearful for and what people are expecting, right? And what is different there? How can we approach them first in a very wonderful setting of understanding that there is some connection, a huge connection between the mind and the body, right? And we call that the body keeps score. Thanks to Dr. Bessel van der Kolk, who first wrote an amazing book about that. Now we know so much about how trauma also settles in your body, and for years that can still be bothersome without you really being aware of that. So what is this trauma-informed care? It really shifts our focus in general to saying, what's wrong with you? To what happened to you, right? So we don't approach people in a trauma-informed care setting by saying, what's wrong with you? Even if you're the doctor, you are the caregiver, you are the counselor, you are the coach, you are a practitioner, in whatever setting it is, you can approach people different by saying what happened to you instead of what's wrong with you. So that in the first place is a really big opening line that we are acknowledging when we are practicing trauma-informed care. We acknowledge that healthcare organizations, medical organizations, clinical organizations, even corporate setting, and in big, larger corporate settings, that care teams need to have that complete picture of a patient's life situation or a client's life situation, or even a person that just walks in a door life situation. We want to approach people different. And in order to provide that effective healthcare service to people in a healing organization, we want to approach them different by adopting a trauma-informed practice. And it can potentially, of course, influence and improve the patient's engagement, the treatment adherence, and the health outcome that we're looking for the provider, for the patients, for the provider, and for the staff in that wellness setting. So it can also reduce avoidable care and excess costs, because we want to look at the overall picture again of the patient, and just not saying, well, okay, so you have pain here and there, or you're anxious, so what's wrong with your mind, right? We want to look at the whole picture and see where that anxiety, for instance, might have settled, or where that PTSD might have settled in the body. So doing so, it can also reduce cost for the patients. Of course, it can reduce excess costs for healthcare and social service sectors. So we want to seek in the first place, and we want to realize that there's a widespread impact of trauma. We want to understand the path out of that recovery, the path for that recovery. Secondly, we want to recognize the signs and the symptoms of trauma in patients, and in the families that are around the patients, in the staff that are working with the patients, right? Sometimes the patient's trauma might reflect on a staff member, and that might also influence their relationship. In the third place, we want to integrate this knowledge that we now have about trauma into the policies and into the procedures of the practice, or into the practice itself, right? So we want to somewhat approach our patient or our client a little different verbally, and that has a lot to do with our bedside manners, right? Again, just coming back to what I first said, what's wrong with you, right? It implies that there's something wrong with you, and just saying instead, what happened to you and why are you suffering from what you're suffering from, right? And then, of course, in the fourth place, we want to always just prevent and avoid re-traumatization. So when we work with people, we definitely want to make sure that they're coming out with the skills and tools and with the practices that they need to improve and to go forward into their transformation to a healthy client or a healthy patient. This is a very comprehensive thing, right? When we're talking about different organizations can use this, different practices, all organizations, all medical organizations, all clinical organizations where we provide healthcare and welfare for people. Then again, also gyms, fitness centers, yoga studios, small boutique studios, anywhere, anything that we do. It might be the chiropractor service. It might be somebody who prevents or who offers holistic services. In all these fields, we need to reassess how we approach people altogether. And so one of the things, there's several different benefits to this. Of course, I told you the outcome. There's also very important things that we need to look at when it comes to how can we do this and what are the 6 pillars of this care, right? Again, so when I started this, I was teaching trauma-informed yoga, and I knew that I was working with patients in a very traumatized setting. Their history was, they were traumatized, their history was difficult, they were in recovery, and I was working with people that were not loving their body, that were not loving self, that were not acknowledging what they were feeling, they were running away from it. And that's why it was so important for me to approach people in a different way, to approach my clients in a different way. So it's all about that mind-body connection again. And afterwards, I took that out of a private yoga and meditation setting into the world, because I thought this is something that everybody needs to hear, right? In the first place, again, I'm going to, what do we do in dialectical behavioral therapy and mindfulness and counseling and coaching and mentoring people in therapy? What are we doing? We want to eliminate life-threatening behaviors with people. And definitely in a trauma-informed setting, that should be one of our first mission or vision statements. We want to reduce therapy into interfering behaviors, right? We want to just not go back to or help the patient step out to low self-esteem and negative thinking and procrastination and anger and missing appointments because of that, failure to follow up with anything, and failure to take directions. So all that we want to include in our thinking of how we're going to approach people. And then, of course, third, we want to overall reduce quality of life interfering behavior. And that's our eating disorders, alcohol, overspending, any addictive behavior, right? Any compulsive behavior that might again result into loss of self-esteem, negative thinking, constantly beating yourself up. So you want to move people already to a place where they can see themselves being the victor, where they can see themselves being in victory and on a healing path. So anything that might interfere with that, we want to avoid in this trauma-informed care setting. Trauma sometimes, going back to that word, appears when we experience very stressful and very frightening or distressing events. And in that difficult, and they are difficult to cope with, right? We cannot control them. We cannot see beyond control. We cannot do anything about it. It could be an incident. It could be ongoing events that happen and stack up in our lifetime. It should be ongoing events or one-time big events, but usually they kind of stay with us over time for a long period of time. And most of us will experience one or more events in our lives that could be considered traumatic. Everybody has little, big, however we want to pack that, trauma in our past, or maybe in a recent past, or maybe in a fast past, distant past, but it stays with us. It stays with us, and usually it might be something that we have to work through with a therapist or with a counselor or with a coach, but it's always is there. It does not go away. So we need to learn to use it and find a way to move through it and move forwards with, right? It causes changes, definitely. If you have trauma and you experience severe trauma, it causes changes in your physical, emotional reaction. You can be easily startled. You can be frightened. You can always be on guard for danger. You can show constantly self-destructive behavior. You might have that substance abuse. You might drive too fast because you're putting yourself in risky and reckless or other careless behavior. And if you see that, and if you acknowledge that, then please, in the first place, reach out for help. Those symptoms of trauma over time, first they settle in our, that happens to us, right? Where our mind is depressed, is full of trauma, is anxious, is in pain, grieving, long-lasting PTSD. This might ultimately settle in your body as well. So you might have symptoms, the physical, somatic, as we call that, symptoms, as trouble sleeping, you cannot concentrate, you're easily irritable, you have easy angry outbursts, or you have aggressive behavior even sometimes, right? And that also is followed by overwhelming feelings of guilt and shame. And of course, PTSD can result even in vivid flashbacks, right? You have trauma that feels that it's happening right now while you have been in a war zone a long time ago. So you might still dream about it and you might still feel that it's happening in the moment. You might have intrusive thoughts and nightmares, intense distress. All these feelings will also settle in your body ultimately and have severe reactions physically as well. And if you're recently or if you're repeatedly exposed And this is something that a lot of people don't know. If you're repeatedly exposed to particularly distressing details of trauma experienced by others, so not necessarily by me, I might experience vicarious traumatization, and that is also known as secondary traumatic stress. And that might be something as seeing a horrible accident being really right there. It is not your family member that has that accident and that maybe passes away in the street or being just drove away, right, by the hospital, and you might be there, but that is also followed by your secondhand trauma. So you feel compassion fatigue, you have that indirect feeling of why am I thinking about this all the time? You kind of beat yourself up even about it. You even get mad at yourself about holding that vision in your mind. But it's very normal that we go through that and that we experience that. So that also might be just feelings of hopelessness there, right? Helplessness, just a sense that you couldn't do anything, you couldn't be there, you couldn't prevent it. All that has big influence on our psyche and on our body. Now, let's say that the body keeps score. What do we mean with that? And what did Dr. Bessel van der Kolk mean with that? That means that many symptoms of this emotional and mental trauma can result in long-term periods of chronic pain and physical stress, physical trauma. So our minds are desperately try to leave that behind sometimes, right? Maybe we do the talk therapy, maybe we do the work, maybe we go back to the event and visualize and process it again and come out on the other side feeling a lot better. But sometimes our bodies are keeping trapped as well in the past, and they cannot really, our body cannot really set that out in words, right? And emotions and feelings. So our body is holding on to that. And these inner physical connections, that inner physical disconnection, can result in also ruptures of self-esteem and confidence and clarity and courage. We just can't see anything, right? We feel that we can't move forward physically, we can't get up, we can't do anything. We feel constantly tired, we stay in bed all day, or we have so much chronic pain that affects our daily living. It has an effect on our marriage, maybe, on our families, on our friendships, on our work relationships. So all that can be caused by something that maybe happened a long time in the past, and you thought you worked, you talked, and you exercised, right? Behavioral therapy, you exercised and you're thinking your way through it. But it is still, that trauma is still at the root in a neuroscience way and associated with the pain and the function and the functional and the chemical changes in our body that it might cause. So it is something that might come back a long time after the event happened. So in our efforts to understand and incorporate trauma-informed care, we have to make a conscious effort to recognize and understand these existing symptoms physically in our clients, and thus propose to the client a more holistic way of treatment, a more holistic approach in our treatment. Not just our minds, but also incorporate the body in there. And what most of us can do to start with that is to, like I said, I gave you already an example in a yoga studio, for instance, eliminate words as, bent over or being corpse pose. And I have tons more examples about that apply to a yoga or, a physical instructor or physical teachers. But these examples also go further, right? It might also be a more gentle approach in the setting of our organizations. What is this really? I always start saying again, urgency, we want to heal this, we want to heal this. Urgency is definitely a trauma response. We want to just heal this fast. We want to just need to get there already. We want to get this over with. We don't want to deal with it anymore. But unfortunately, it takes a little bit longer time because this whole process of how these pains, how this grief, how this trauma, how this event that happened to you can settle in your body is a long process, and it's prolonged exposure therapy sometimes, right? Sometimes we might have to do EMDR. That is a clinical process that you can go through. You might go work with a therapist and have that talk therapy. You might have the somatic experience on top of that, or the therapist will help you with that movement practice. And that is the best thing that you can do in that practice, to also incorporate that holistic approach, and also advise your patient or your clients to do some gentle physical movements, very soft yoga movements, to become aware of your body and to be able to express where you feel it and where your pain is holding. And also in meditation, we can do that with our patients and with our clients, because in that meditation, we can help our clients find and feel and heal through it. So we have to find, again, where our trauma or where our chronic pain is settling, where we have these issues in our tissues, right? Like, this is something from a long time ago. My mentor always said, where is your issues in your tissues, right? Where do you feel that pain? And where is it really holding on so long already? Where is that chronic pain holding? So before we actually just go to the doctor and get medication for it, meditation might be your medication. Meditation might be your medication, because we want to incorporate that in that holistic practice of helping people with trauma, grief, loss, pain, all the above. So we have a gradual integration that can be transformational to heal our patients and survivors of trauma. There's a few things that I'm going to touch on and that we can do, right? So again, we have exercises that maybe start feeling comfortable and move through the body, right? Where people also start loving their body, where our client and patients start feeling that they can accept themselves the way they are, and that what happened to them doesn't mean that they have to carry that through life. What happened to them does not define the future. What happened to them does not define them, does not define you, does not define the wonderful, amazing person that you are. So we want to try to find that. We want to might go through breathing practices to really get a grip on anxiety and get a grip on feeling tremendous stress all the time, right? We want to feel safe, and we want to create a sense of stability in our body. And on top of that, we want to really, really go into more interventions, more practice, and more ways to find out what we can do to move beyond talking only. Right? Sometimes we say to our patients, it's great to be able to put your feelings into words, and to feeling that somebody understands your suffering is very comforting, right? You find that support in therapy, you find that support with your coach. But after years of holding on to trauma, it doesn't really mean that your body is feeling safe as well, that your physical self is feeling safe as well. So the real method is also resetting the physiology. And it is very, very important to pay attention to that. So as a recap, there is the individual's experience of trauma. It impacts every area of their functioning, right? Physical, mental, emotional, but also behavioral, and also social and spiritual. It is always there. It is a somatic reaction. Trauma has a somatic reaction overall, and that can last for years. Pains stomach pain, abdomen, lower back, upper torso, right shoulders, all this, the feeling of being stuck, that is really, really important for us to approach. And I have worked with patients that went through years of, they said, I can't go to public speaking. But meanwhile, after they had suffered from tremendous trauma, they maybe had talked for years to lawyers, attorneys, defense attorneys, parents, people, friends, right? Mutual friends and judges and victim advocates and people that were in their support system, directors that were helping them, coaches, therapists. And then after years and years and years of talking, they would still come out and say, I can't sleep. And that's where that is. That's where we notice that there's more to it, that of the things that they have experienced, right? Our clients have experienced more than just that. A couple of the things that we have to notice when we go through the whole approach in organizations, in your medical field, in your clinical field, in any form of caregiving, in any form of housing that we provide for people that have suffered abuse, people that have suffered pain, that are going through PTSD, or that are coming to us for care, well care and health care. We have to provide safety. We have to provide a very safe environment. We have to make sure that they definitely feel that they are being heard, that there's a trustworthiness, that we are building an understanding relationship, a supportive relationship with them, right? And then they have to feel that more people are going through that, so that there's peer support and that there's dependability and that they're not alone and not the only ones that are going through that. And that there's collaboration in this whole effort to move forward, in this whole effort, that there's everybody that is trying really with you as a patient or client to go and get out of this, right? And that the skills and the tools are being provided. And that there's an environment and, that it will empower you to strengthen your voice, that will empower you to be in control of your own life, that will help you identify your strength, your values, and your skills. And then, of course, for us, it's very important, none the least, to be cultural competent, so that we can ensure sensitivity and awareness for the patient's cultural, historical, and gender backgrounds. And that is very important for us in this healthcare setting. So I hope this helped you a little bit today. If you are a caregiver, if you are in the well-being, the health industry, the service providing industry, the caregiving industry, an organization that helps others in any setting, maybe it will help you to see through and with people, right? Seeing through is not always necessary the very first time that we meet people. But seeing that we can work with them and that everybody has a story, that we can meet people where they're at, and that everybody has something that they have struggled with and that they're moving forward with or trying to move out. Everybody has something. If we can see that, and if we can see how, and to approach people in a gentle way, in a softer manner, with amazing trauma-informed skills, then we can all together go forwards into healing the world. Thank you for listening today. Thank you for being with me on this very important topic. I really appreciate your comments. I really appreciate your feedback. I hope you'll reach out to me, elianhaan.net, anytime. And on my website, of course, there's all my social media links, all the ways you can make an appointment with me, or you can book me to speak for you, right? And just reach out anytime. Have an amazing, amazing rest of the day. Make it an amazing day. I always say, namaste. I will see you next week. Thank you.